A very big hello to all my dear students. How are you all? Welcome to the T2O series of your favorite channel, You and I with Dr. Ruchi Rai. What next? So today we are discussing letter P. And of course, we cannot miss this condition. Yes, pterygium. So you all know pterygium is a subconjunctival fibrovascular tissue encroaching the cornea. I won't be writing everything, but these points are important. You may note down. First question, I'll just go question oriented. What is the first question they ask you here? Is it inflammatory or degenerative? Of course, it is not inflammatory. Okay, please remember what you have to remember here. It is the elastotic degeneration of conjunctival stroma. And interesting thing is this is same for pingicula. The pathological chain is same for pingicula. Remember. This was point number 1, exam question. Second question they have asked you in the exam is, it is more common on which side? You will say it is nasally. Then they have asked you etiology. It is exposure to ultraviolet rays. That's why it is common in tropical countries. So which ultraviolet they have asked you? You will answer it is UVB rays. Don't forget UVB rays, not A. Okay? A कहाँ पढ़ते हो? C3R treatment. Okay, next question kya hai? Next question they ask you, of course, we all know that there can be high rate of recurrence. So what is the methods of preventing recurrence? Preventing recurrence, we generally go for mitomycin C or autografting, isn't it? Okay, if I talk about clinical features of this condition, main problem is cosmetic, okay? We all know the main problem the patient complains is for cosmetic. Sometimes it can alter the corneal curvature leading to astigmatism. Right? And third, if it encroaches the cornea, right? You see, if this one, if it encroaches the pupil, I mean to say pupillary area, now it can lead to diminution of vision. Okay, very important point. If you have a patient who is where you see the pterygium is encroached the pupillary area, should you immediately remove it? No. Answer is wait for the tissue to cross the pupillary area, reach the other side, then only remove, because whenever you are removing, there is going to be some scarring. You don't want that scar to be at the center of the pupil. Okay? This is also asked. Another question is best method to prevent recurrence. Best method to prevent recurrence will be autografting. I hope you all are clear about autografting. If this was suppose the pterygium, right, and you have removed it with the base sclera, you just take a piece of the conjunctival flap from superior-temporal quadrant generally, dissect further to include the limbal stem cells. If this is the X side and Y side of the graft, you have to just be careful that you are stitching the X here only and Y here. Okay? This is so that the limbal stem cells are actually shifted. This is what is autografting. Now they ask you another very recently asked question. If I am going to create a larger bare sclera and then put a larger graft, we see the recurrence is almost 0.1% or you can say 0, isn't it? This is what is called perfect surgery. Perfect is a full form for pterygium extended resection followed by extended conjunctival transplantation. Okay, so we will keep all these things in mind. Another important question, how do you differentiate pterygium from pseudopterygium? Don't forget the glass rod test. Glass rod test says that if this easily it is passing, if the glass rod passes easily underneath, this is pseudopterygium, no confusion. This was debatable, but please understand, pseudopterygium kya hai? It is just a scar tissue which is resembling as the shape of pterygium. It is just attached at the apex. So the glass rod can pass underneath it. Samajh aaya? And when it is not passing, then it is, the case is that this is one is your pterygium. Right? Clear? Okay. So here you can also see if there is an infiltration ahead of the pterygium like this, it is mainly considered a progressive one. Right? This is another important point. Okay. So coming to, so these are so many questions I have discussed here. I think the MCQ is missing in this. I don't know, I must have missed it. So sorry for this. But I think there's so many MCQs we have solved on pterygium and you know what are the questions, right? So treatment is always excision with autografting is preferred. You can go for mitomycin C as well. I hope you enjoyed this session. Thank you so much. Stay blessed and keep smiling.